Hi, I'm Jenny Brown Parker, and I'm a lecturer in the Department of Applied Linguistics and ESL at Georgia State University. I have the pleasure today to speak with Dr. Elizabeth Armstrong-Mensah. Dr. Armstrong-Mensah is Clinical Associate Professor and Undergraduate Program Director in the Health Policy and Behavioral Sciences Department at Georgia State University. Hi, Dr. Armstrong-Mensah. It's a pleasure to meet you today.
Well, thanks for having me.
Yeah. Tell me, how many years have you been in global health?
Oh, well, that's a very, very long time, I'd say. I'll say starting in the 1990s.
Okay.
That was when I graduated from college and I started to do some NGO work. And then I worked with the United Nations and did some global health work. And I'm here now doing global health work. So a very long time, more than 20 years, I'd say.
Okay, great. So you've seen a lot, I'm sure, and had a lot of responsibilities over the years.
Yes, I
Um,
have.
Tell me a little bit about your responsibilities here at Georgia State.
hmm So here at Georgia State, I wear several hats. I'm faculty with the Department of Health Policy and Behavioral Sciences, School of Public Health. And in that capacity, I'm responsible to teach. I have a workload that straddles instruction,
Mhm.
research, community service, and administration. Since I am one of the directors of the undergraduate program, I perform administrative services as well. I do lots of research with students. I do mentoring. I have a study abroad program to Ghana. Actually, I'm just coming
Oh,
from
wow.
one. I host an event at the school for students and faculty as well as alumni and staff. I call it the Meta Series, Meet and Talk series. I bring them all together in one space. Once a semester, and we have a good time. We learn about public health, we network, and we learn.
Fantastic.
Mhm.
Thank you. For students in the class that don't really know what global health means, can you tell me a little bit about what it encompasses?
Yes, this is a great question because I've had students or people mix it up with international health, right? So
Hmm.
when you talk about global health, you're primarily talking about health issues that transcend national boundaries for which global action and cooperation are needed. So it's not like public health where you're focusing on what's happening in a certain country, a certain community. Here you're looking at what's happening across the globe. Right. So it's things like HIV, AIDS, it's things like COVID-19 that we just experienced, right?
Hmm.
Ebola virus, SARS, HIV. These are
Hmm.
health issues that do not occur only in one space geographically, but kind of cut across. And that's what global health focuses on.
I didn't realize that. So when somebody says that they're in public health, that means just in the country where they're doing their research?
Yes, you're
Okay, I didn't
focusing on
realize.
a particular country or
Uh-huh.
community, but you're not looking beyond the boundaries of that community, or that country.
And you mentioned international health. Is that different from global health as well and different
It
from
is
public health?
it, it is different from public health
Hmm.
and global health in the sense that, international health focuses on health issues that occur in someone else's country and not your country,
Oh,
right? And it's an offshoot of colonialism, right? So during colonialism, what emerged was tropical medicine when colonial masters went down to Africa to try and take colonies, right? When they got there, they experienced diseases they had never experienced before, for example, malaria. And so
hmm.
they charged their scientists back home to kind of look into this disease and come up with some kind of panacea so we can continue to plunder the colony, right? So
Oh,
then
wow.
tropical medicine emerged that focused on health issues that occur in tropical nations, right?
Uh-huh.
But then the African countries are looking, you know what, enough is enough. We want our independence, right?
Hmm.
So after
Hmm.
independence, what became the health focus of the world was international health, right? And this is where colonial masters said, okay, I am Great Britain, I am whatever country. We have institutions and places of learning where people are learning about diseases that occur in your space, so let us come and be the ones to help you. So that's international health issues that occur in countries other than one's
Hmm.
own,
Hmm. Hmm.
and
Oh,
international health
interesting.
primarily.
I didn't understand that distinction.
That's a distinction. And in those
Okay.
days,
Uh-huh.
international health would focus on issues like maternal and child health, water and sanitation issues, nutrition
Hmm.
issues,
Hmm.
those were and non and communicable disease, not but communicable disease. But global health
Hmm.
spans, both communicable and non-communicable insofar as they transcend national boundaries.
Okay. All right. Thank you
Mhm.
so much.
You're welcome.
And why is global health so important?
Oh, I mean, it's so very important. It's so very important, especially in this climate, in these times, right? Several reasons. First of all, there's this whole issue of global interconnectedness, right? So we are a global village nowadays. It's not, in the past, it took a while to move from one country to the other. Nowadays, it's very different. I can get on a train or on a plane and get to Germany or Ghana in a few hours or in a day or two, but that didn't used to be the case at first, but now it is. And so it means that if I have a virus, if I have some kind of condition that is contagious, and I get on a plane, I can first of all spread it to the people on the plane. And then when I get to my destination, I can spread it there as well. So that makes global health very, very important because we want to know what's happening so that we know how to plan and how to prevent these conditions from happening or these things from happening. There's also the issue of global health security. Global health security says, okay, let us maintain diseases at their source so that they don't overflow to other countries, right? Because you see, the way health is managed in one country pretty much impacts health outcomes in another place, right? So if you think about the Ebola virus disease that spread in 2014, right? The world was like, okay, we know it's in Guinea, Liberia, Sierra Leone, but we are on edge because we know that if we don't maintain the disease at its source, it's going to spread and it's going to become a very terrible pandemic, right? So everybody was on edge. So that also makes global health very, very significant in today's world. Then there's the issue of urbanization, right? So with globalization, where countries are dependent on each other, they're interdependent, they're working to each other, either politically, economically, socially, it's caused people to move around the world a lot. And when people move, they go to where the jobs are, and the jobs are in the urban areas, right? And these urban areas have been set up in a way that they're not ready to absorb a huge influx of people at one time. So what it means that people are living in close quarters. So if someone has a condition, it will spread just like that. So it makes global health very, very significant. Then there's the issue of globalization of trade, right? Maybe you ate an apple this morning, it came from Chile. Maybe you ate a banana, it came from maybe Peru. But the question you need to ask yourself is, were these products regulated before they left their shores to come to the United States? If they weren't properly regulated, if they didn't really inspect them and they just sent anything across, then it means we could have a global food safety pandemic on our hands, which makes global health relevant today.
Yeah, are there organizations that do monitor like the trade of food, for example, in terms of rules that shippers should follow or growers should follow, or is it hard to regulate that across international borders?
Well, I think every country should have that, but as to whether they are really enforcing that is another problem. The US, we have the Food and Drug Administration, right? In Ghana, we also have the Food and Drug Administration, and they also have similar roles and responsibilities. But the question is, to what extent are all countries doing this? Is there a time when they say, you know what, just let the container pass? Or is there a time when they're really having their clipboards and their pencils and their pens and they're looking and they're checking off? Because if it's not done uniformly across the world, then there's a probability that something could slip through and people could eat certain foods. And that's why sometimes there's a recall of maybe beef from Tokyo or this product from that country. Maybe because they find out that maybe something is happening because people consumed a certain product from some country.
I wonder if makes me wonder if there are differences in the way different cultures think about food safety. I mean, or is it pretty much agreed upon across the world what would be safe practices?
I think this would be like a global thing. I mean, because WHO would, of course, want to say that we have to make sure that what's crossing over should be healthy. So I think that it's not a culture thing, as I think it's a standardized thing, but as to whether people are doing it the way they ought to, or countries are doing it the way it ought to be done is another question. Yeah.
Forest. Right. Yeah. Okay, interesting. How about sorry, I'm getting off on a tangent here, but what about like I was thinking in terms of like organic and bioengineered food? I mean, do some countries not accept that from the United States?
I'm not quite sure about that, but what I know is that in developing countries, for the most part, I mean, their agricultural products have been organic because there was a time when we couldn't really have access to fertilizers, right? To kind of like fertilize the soil and to increase, the size of produce. So in many developing countries, what you find are organic products. In the US and in developed countries, that's where you're finding genetically modified foods and stuff and things like that. But in many developing countries where access to fertilizer is an issue, because of course you've got to buy it, right? And they're not produced in country, you'll find people growing or farmers cultivating, you know, foods that are organic.
I'm
But
wondering
but
if
it doesn't mean
cultures
that
that,
right, but it doesn't mean that some people don't have access to fertilizer and therefore do not grow products that are that have been fed with, I mean, yeah, crops that have been fed, fertilizer. But for the most part, it's being organically grown.
I wonder if other countries are willing to accept the non-organic food coming out of the US and the bioengineered food coming out of the US.
Well, I
Probably
guess
depends on the need.
well, I guess it depends on if they understand what these kinds of products mean, like what it means to eat something that is genetically modified.
Yeah.
If they do
Interesting.
understand, then of course they might say we don't want it, right? But do they really understand? When you
Yeah.
see when you
Yeah.
see when you see let's say tomato fruit and it's that big, like, oh yeah, you want that one, right? But you don't know what's been done to it, right? So
Sure.
when people understand, and I think in some places people are beginning to understand, especially in developing countries, that when you use fertilizer, it ends up sometimes compromising the crop, because if you don't wash it properly, then you might be ingesting things that are laced with products that you don't want in your body, right?
Yeah.
But then it goes right back to, do they understand what these GMOs are and all these other inorganic products, that are being, produced in different parts of the world. And you talked about the United States. Yeah.
Interesting. I went down the rabbit hole there. Are there other global health issues that are important to think about?
Yeah, I think you need to think about global health equity as well. When we talk about health equity, we're talking about the potential we're talking about the opportunity for everyone to realize their full health potential, right? But then we know the social determinants of health make it difficult for that to really happen, right? But what global health is saying is that if we are able to set things up in a way that people within countries and across countries are able to realize their full health potential, then we reduce the chances of diseases crossing borders and affecting people. Because if I'm able to have access to healthcare because maybe my need is transportation, then I should be okay. If my need is health insurance and I get it, then I should be able to go and be seen, right? But if the inequities exist within and across countries, then we have a problem. And that's where we'll have global health emergencies, and then the world doesn't know what to do all of a sudden. So that also makes global health very relevant in today's world.
Yeah, absolutely. Especially COVID's still in my mind.
Yeah, it's fresh in everybody's mind.
Yeah.
Yeah.
So in talking about why global health is important, you've brought up several challenges and issues. Are there other pressing issues in today's times?
Well, if you're talking about challenges, there are challenges, right? So there's the challenge with cultural competency, right? The ability to integrate cultural competency into interventions or programs to improve upon patient or population health outcomes, right? So when something occurs, let's say there's a global health emergency, for the most part, some of the solutions come from the developed world, right? And so maybe there are interventions or there are programs to be implemented. But these programs come based on a Western model of doing things. So these interventions do not take into account the cultural beliefs, norms, and values of the recipient countries. So then it makes the whole thing difficult, because you're asking us to do it this way, but we don't do it that way.
Right.
So, and if you take Ebola, the outbreak of Ebola, for example, the idea was, okay, let's try to do some isolation, let's do some contact tracing. Fine, we get that. Let's bury the bodies away from, where people live. We get that. But they forgot that some African culture allow the living to touch their dead before they say goodbye. And as we touch the corpse, and if there are some juices that have come out and it's infected, you can transmit it easily. It was when an anthropologist came on board and said, let's look at that also, that we began to see some changes. So that's where culture comes in. That's where, if these interventions consider culture and consider that, there are different ways of doing things other than the way we know how, then we wouldn't have some challenges, right, when it comes to global health issues. There's also the issue with partnerships, right? We call them global health partnerships. These are when, various countries come together, to try and find a solution, to a particular issue, right? But these partnerships are not equitable, or they are not balanced, because if I see that I'm a first world country, a developed country, and I'm coming to the table and I see that you're from a country that's developing, I'm not going to give you the floor to say whatever it is that you want to say, right? It's pretty much what my agenda is. So you're not listening to me. And so whatever you're coming up with regards to the partnership is not taking cognizance of what my people need, what I need, and what I think would work for my population. And that's a challenge. Then there's the issue of global health financing, right? So we had the Millennium Development Goals that were launched in 2000 and were to have been achieved by 2015. We made some progress. We didn't really achieve all the eight goals, right? So now we have the Sustainable Development Goals that were launched on the heels of the Millennium Development Goals in 2015 to be achieved by 2030, 17 of those goals, right? And countries are supposed to be able to meet those, I mean, the targets associated with those goals and the indicators, right? But the question is, so how are developing countries to meet these targets? Because you've got to come up with interventions. If you want to reduce maternal mortality rate, for example, you've got to come up with programs to make that happen. If you want to reduce
funding for that too.
Right. If you want to control population, we need contraceptives. If you want to take care of reproductive health, but there is really no funding for that to happen, because developing countries, first of all, don't really have the budget for that, right? And the developed world say, well, you know what, yes, I'll give you some funding, but it's dependent on how much money I have this year I'm willing to give to you. So it's very volatile. This year, okay, we have enough in terms of revenue. I can give you two arguments, say 2 million. Next year, we didn't do two, I can give you only 500,000, and that messes us up big time.
Yeah, and it puts the developing countries really in a very dependent position, just waiting for the call by the more developed country.
Yeah. So those are some of the challenges.
Yeah. Absolutely. And also, I mean, I'm thinking of like political institutions really grasping the importance of health across international borders, right? Because as you mentioned, people are very mobile, and it takes just hours to cross a border these days.
Yeah.
Absolutely. So you touched upon the importance of cultural competence and understanding the norms and values of other cultures when negotiating or planning or partnering together. Do you have any thoughts about what makes for effective intercultural communication? Or the students in this class have been learning about the differences between cultural competence, which is important, but also cultural humility, this idea that you're never really going to become 100% competent in another culture, but if you take on if you take a humble approach and always open and always learning approach to another culture, that's going to serve everybody better. Do you have any thoughts about what makes effective communication? Or
Oh yeah. I mean, so you're talking about cultural humility and effective intercultural communication, right? So yeah, I mean, I think those are very important, because once you have cultural humility and you are willing to be you're ethno-relativistic, meaning not being ethnocentric, where you're looking at everything through your cultural lens, then it opens the door for so many things. It helps to build trust and therefore adherence to treatment, especially in marginalized communities, right? It allows for proper diagnosis and appropriate care, because you're coming to me, you see that, okay, maybe I don't speak your language, and so you're being careful how you use the jargons. Maybe you want to bring an interpreter along so that I'm telling you, so that you can understand what I'm saying, not hear what I'm saying, but understand what I'm saying, and therefore provide appropriate treatment. I didn't say my right leg, I said my left leg, but you ended up cutting the wrong leg, just because you didn't have the right interpretation, right? So it helps with that. It also promotes respectful care, right? As providers are more likely to respect the patient's cultural beliefs, their values, their practices, and all of this, as I said already, builds trust and improves patient satisfaction with the care that they receive. It also helps to reduce bias, stereotyping, and prejudice, right? Because it encourages healthcare professionals to recognize and address their own implicit biases, right? Which would otherwise lead to unequal treatment and care. So humility is very important, right? Cultural competence, you can communicate effectively, you can interact effectively. Sensitivity is you were aware and now you're doing it. Right. So that's really important. And to be able to do it requires a lot of humility, because then it's like you don't have all the power, right?
Right.
Because you're trying to
It's more of a
understand somebody else.
partnership.
Exactly.
I like the term that you used, and this might be new to the students, ethno-relativism. So
Yes.
so you said that's in contrast to looking at the world through your own cultural lens.
Yes.
And if I'm not mistaken, it would be more to try to see the world from other people's lenses. Is it sort of
Exactly.
a take on empathy?
It's a take on respect, a take on yes, empathy, respect, and um, humility, and the fact that your culture is not the one and only.
Yeah,
It
it's
may
not
not
the
be the best.
central.
Yes,
Yeah.
yes. Because sometimes people go to evaluate programs and they say, well, it failed. Just because we're looking at things from their point of view, they didn't do it this way, they did it that way. No, but that's how you do it in your country. But that's how they
Right.
do it in this country.
Right.
Right. So you need to understand, how things work in certain spaces so that you can end up with a good judgment
Yeah.
or claim about what it is that you're doing. But if
Yeah.
you look at it from your point of view, you'd always say people are failing.
Right.
Yeah.
You're looking at your culture as central and correct, and then
Yeah.
judging everything based on that one perspective, that kind of
Yes.
with blinders on.
Very narrow, parochial.
Yes.
Yeah.
Uh-huh. Yeah, parochial.
Mhm.
And how about health literacy? So the students in this class have been learning a bit too about how important it is for healthcare providers
Mhm.
to evaluate and understand the health literacy of their patients, and then to adjust their communication style
Mhm.
to suit the needs of the patient and the patient's families.
Yeah.
Do you have any thoughts on health literacy and its importance?
I do. I mean, health literacy is pretty much about, the patient understanding what the primary care provider said and they being able to implement what was told them to improve upon their health outcome, right? So it's very important, right? So, you know, patients with higher health literacy are more likely to understand the diagnosis and treatment options, right? So what it will mean is that adherence to medication regimens, they understand they've got to take it 3 times a day. They didn't like, okay, what did they say? Did they say I'm supposed to have 3 big tablespoons full, or did they just say 1 tablespoon full, right? And it's able to reduce, if patients have higher health literacy, they are more likely to have reduced hospitalizations and recurrent hospital visits, right? Because then they know what they're supposed to do, right? Um, and then it also reduces emergency care usage, right? Because they've been told what they're supposed to do. They understand. They're able to communicate. And so now they're doing what they're supposed to do. It also enhances communication and trust. You see, when healthcare professionals recognize and address health literacy levels, they can tailor communication using plain language and visual aids. Plain language is something you say that we all understand at one time. It's not me trying to say what, like you just said to me, ethno-relativism. What is that, right? I wouldn't use that with the patient because I'd lose them, right?
Yeah.
So you want to make sure. And then patients feel more empowered and involved in their care, when you recognize and address their health, when you as a healthcare provider recognize and address their health literacy levels. And then it also reduces misunderstandings, like I talked to you about earlier about medical instructions, right? So there'll be reduced medication errors. They will not miss appointments because they understand that they need to come, and then there won't be inappropriate use of healthcare services because they understand what they're supposed to do. And so they're not getting, except it's something that's beyond them, but they're not just coming and coming because they don't know what they're supposed to do. They're doing what you've asked them to do, and all things being equal, it's working. So they don't need to be coming, that often. Yeah.
Right. Yeah. Well, one thing I noticed that you've mentioned throughout our talk here is trust, building trust with patients,
Yes.
and empowerment, empowering patients, more of
Yeah.
a partnership.
Mhm.
And I can imagine too, if health providers are conscious of health literacy and the health literacy of their patients, there'd be more patient satisfaction. I mean, not just better patient outcomes in terms of health outcomes, but
Mhm.
patients probably are happier, right? When they
Yeah.
understand what's going on and they feel respected. Respect is another theme that's come out of
Mhm.
our talk today.
Yes. Yes.
Thank you.
Those
Thank
are
you
all
so
very
much.
important.
Yeah.
You're welcome.
Yeah,
Yeah.
thank you.
You're
How
welcome.
about any advice? Any advice to international students that want to study healthcare in the United States?
Yeah, I have a few for you.
Yeah,
So
thank you.
what I'd say is, well, congratulations for coming to the United States and wanting to study and to become a healthcare professional. That's a great thing. But there's certain things that I'd like to share with you by way of advice. Try to understand the US healthcare system, right? Learn how healthcare is delivered, financed, and regulated. Understand the roles of different healthcare professionals and how interdisciplinary teams function. Because I know that in many of the developing countries that we come from, things are pretty much siloed. In the US, it's not like that. Things are pretty much interdependent. You need to understand that. Number two, strengthen your communication skills, right? Learn to communicate, um, you know, very well with your patients, right? So focus on, medical terminology, right? Don't try to use jargons. Use plain language for patient education. Listen actively, be empathetic, practice with native speakers, because when you come from a different country, first of all, there's an accent situation, and then we use certain words differently. So I'm British trained, and so there's certain words we use on the British end, that's not what they use on the American end. But if you want to be able to communicate effectively with your patients, you've got to try and learn some of these things. And then embrace cultural competence. We've talked about this already, right?
Yeah.
Be open to learning about diverse patient populations and cultural norms. We have different racial groups in this country. You will do yourself a disservice if you don't learn about these racial groups and what works for them. And then understand how cultural beliefs affect health behaviors and decision making. I'd also say prioritize health literacy awareness, right? So recognize that many patients have limited health literacy. Learn to use tools that that use a teach back method. So when you've interacted with your patients, and then not in a condescending way, you want to say, okay, so can you just kind of like um, tell me what it is you're going to do. What have we discussed so far, and what is it that you're going to do when you go back? And as they talk back to you, you'll get to know if they heard you, if they didn't hear you. And if they didn't hear you, then it means that the literacy hasn't occurred yet, right? Because health literacy is not ability to read and write. It's ability to listen to what you are telling them, they understanding, and they being able to implement that to improve upon their health outcomes. I think if you do these and the other wonderful things I know you know how to do, you should be successful when it comes to health literacy and working with your patients here in the United States.
Thank you so much. I love that advice. And much of what you said, we do talk about in this class, the active listening, how to be an active listener, the teach back method. And if we haven't already, we will practice the teach back method, not using jargon, plain language. Yeah, thank you so much. You've echoed so much and really provided a really rich context and lots of great information for me and our students. I really appreciate your time. Anything else any questions or anything you'd like to add?
No, I just wish them all the best and just take advantage of this opportunity and just learn where your weaknesses are. There's nothing wrong with acknowledging that you have a weakness here. Just as you rejoice when you know you have a strength, rejoice also when you identify the weakness, because in addressing the weakness, you add to your strength. So I just hope that you are able to learn and have a great experience.
Thank you so much. We really appreciate your time.
You're welcome. You're welcome.